recognize the gentleman from Virginia, Mr. Griffith, 5 minutes for questions.
Thank you very much, Mr. Chairman. Dr. Woodcock, greatly appreciate the passion you showed earlier in your testimony. I would agree with you on that passion, particularly about bringing innovative treatments for rare and terminal diseases. I have a little bill that would allow folks to get early access or early approval to those drugs in order to help them, and what we believe will actually lower the cost of some of that experimentation. We'll talk about that another time. I do want to talk about a bill. I know what we were doing here today is important, but I do want to talk a little bill we have waiting over in the Senate. The House passed the Drug Quality and Security Act. It was a bipartisan, bicameral compromise to prevent another fungal meningitis outbreak like the one associated with NECC's tainted sterile products, where we had 64 Americans unfortunately died as a result of that situation. I am proud of the legislation that I worked on with Congressman Gene Green and Diana DeGette. Ultimately, although we had a different package originally, we came to a compromise with our Senate colleagues and with your agency, and I look forward to the Senate getting around it. It's held up for other reasons, but I look forward to the Senate passing the bill and it being signed into law. And I am committed to engage in oversight to make sure that patient safety is being properly protected. I also look forward to the agency developing the notification system that Congressman Green, Congresswoman DeGette, and I authored to ensure that the FDA works more closely with those state boards of pharmacy to prevent another public health crisis. That being said, there were some areas that we thought we might be able to get fixed that we didn't in that bill that have raised some concerns, and I would like to ask you about those in regard to that Drug Quality and Security Act. In its previous draft guidance, the FDA recognized the importance of maintaining an office stock of compounded drugs that doctors can readily access to and administer to patients in their offices. Can we rely on the agency to continue to allow doctors and hospitals to order and keep compounded drugs on hand for office use?
Well, we're going to have to see what is in the final bill, if it's enacted, and then, as I understand it, it really you removed the court disparity, which I didn't fully understand, but was a problem, and so we can, and it leaves the previous statute more or less intact, and we can implement it aggressively. And obviously, that's one of the considerations in there is what are the four walls of the of what is federal, what is state, and
right,
what is permitted.
And we didn't change anything in regard to office use, and so there's some concern that maybe we should have put it in. It was compromised that we would just leave it silent, and I hope that we can count on the FDA. I know you maybe can't answer that today, but I would hope that we can count on the FDA to leave that part of it that was working very well, which the FDA had previously done, leave that intact, because I don't think there was any intention, certainly not on our side, that be changed in any way. Likewise, repackaging of sterile drug products has typically been regulated by the agency in the same fashion as compounded drugs. Repackaged sterile drugs are vital for many patients, especially those in ophthalmologic health issues. Likewise, can we rely on the FDA not to go in and create chaos and to preserve the access to these repackaged sterile drugs and limit the impact of burdensome regulations on that practice?
Well, our intent certainly is not to create chaos.
Yes, ma'am.
All right, but we do, I think one of the goals, mutual goals, is to prevent contaminated drugs. And that's really our goal and your goal as well, I believe.
It is, and we just, there were some clarifications that everybody decided to let go and hope that it works out, and so I'm just worried about those areas. The last of the three that I have is the nuclear pharmacists. They compound drug products that have a short radioactive half-life and must be quickly delivered to a healthcare entity for administration to a patient. Sometimes this must be done in advance of a patient-specific prescription. Can we rely as well on the FDA to continue to try to monitor that in the same fashion that they did before this bill was passed? And I know that the Senate, is either going to pass it today or next week, but anticipating that, since it was a compromise worked out between the two bodies and the FDA. What are your thoughts on that?
Yeah, well, the nuclear pharmacies have not represented a problem here. We have a scheme with them. We've been very successful in implementing a regulation of positron emission tomography facilities, and that's gone very well. And so I think we should continue along that path.
And I appreciate that greatly, and I would be remiss, you know, it is good to see a witness with passion and your dedication. We may not always agree on how to get there, but I always appreciate the fact that you come in with honest answers and a willingness to try to work things out, and I appreciate that. And
Thank
with that, Mr. Chairman, I yield back.
Chair, thanks, gentlemen. And